This segment is sponsored in part by One Brooklyn Health.
It is Maternal Health Week and the perfect time to highlight expectant mothers and the healthcare challenges that many of them face.
That's right. The experts from One Brooklyn Health are here to talk about the rise in infant and maternal mortality and what they're doing to provide top-notch care. Welcome.
Dr. Viswanathan, first off, can you give us a picture of the rates of infant and
Infant mortality.
mortality in the U.S.?
So the rates of infant mortality, amazingly, have actually gone up, particularly over the last few years. And it is up to 5.6 per thousand live births, which is a significant number of babies who can die. And so it's a problem.
Yeah, that's alarming.
Yeah.
And there is also a rise in maternal mortality rates. The rise in maternal mortality rates, the current rate is something like 31 for every 100,000 live births, which means a woman who is either pregnant during pregnancy or within 42 days after the pregnancy ends is at risk. And what is really sad is that the number was somewhere in the 20s in 2019, and in 2021, it's up to 31 per 100,000 live births. And if you look at only black women, the rate is about 69.9.
Well, Dr. McCullough, do we know why there's such a difference between the U.S. and other developed countries?
Well, there are multiple reasons why the U.S. is so different from other developed countries. U.S. has more of a heterogeneous population as opposed to some of our European colleagues where they're a lot more homogeneous. There are also health disparities, significant health disparities in the U.S. A lot of those countries, for example, in Europe, have national health insurance, so moms have access to care. Here in the U.S., it's very spotty. There are areas, especially in the South, in Appalachia, where there are no OB/GYN practicing. And now with the reversal of Roe v. Wade, we're going to be seeing a lot more maternal mortality. So the combination of lack of insurance, institutional racism also plays a significant role in this increase in maternal mortality.
And Dr. McCullough, what does access to proper prenatal care look like in New York?
Okay, so if you're wealthy, prenatal care is not a problem. Where we operate in Brooklyn, there's a dearth of insurance. Patients are lacking insurance. Also, there's significant disparities as far as determinants of health. So if you're poor, there is a lot of lack of
But thank goodness
care.
you all are here, because what is One Brooklyn Health doing to respond to this?
So we have instituted a number of programs to help in this area. Main one is Centering Pregnancy, which is a group practice model where a group of 6 to 8 patients are seen by a midwife. These patients are able to form a buddy system. They're given information in group in terms of, also this has shown to decrease anxiety. Studies have shown that it also decreases preterm delivery rates, decreases cesarean section rate. So there's better outcome, and we have seen that in our population as well. We also have a robust midwifery program. More than 50% of our patients are delivered by midwives. So we're incorporating doula services as well with our midwifery program to help in this disparity.
Okay, so that's one part of it, but Dr. Viswanathan, what are you guys doing after the babies are born to offer services to those new moms out there?
Okay, so there are two things. Some of the services are for moms, and there's a program called Healthy Families, where mothers are identified even during pregnancy. And it's a voluntary program, and there is home visiting, which can be weekly, even after the baby is born. So the home visiting person really goes and makes sure the baby is okay, the mother has everything that is required, and in the process also makes sure that the mother is okay. And so that's one. The other thing is we are a level 3 perinatal program, so we have a level 3 neonatal ICU. A significant number of our babies are premature, so we have round-the-clock, 24/7 board-certified neonatologists who take care of these babies and who are there in the delivery room when they are born. The second thing we have, we are a baby-friendly organization, which means mothers are taught skin-to-skin is done immediately after a baby is born, and breastfeeding is encouraged, and actually we have lactation consultants. In addition, we have Healthy Steps, a program which is 0 to 3 in every one of our pediatric outpatient centers, where a Healthy Steps specialist connects with the pediatrician and with the mother to teach them nurturing caregiving of these babies, so that addressing sleep issues, feeding issues, tantrums, and just to see what the babies and the mothers need.
Yep.
So to combat maternal depression, particularly after a baby is born.
This is a one-stop shop that One Brooklyn Health
is
is
amazing with
doing.
all our programs.
Thank you so much for coming on the show, enlightening all of us and our viewers, and continue the great work that you do there.
Thank you.
Thank you.
And don't
for
forget, you
having
can
us.
scan the QR code right there on the screen to learn more about One Brooklyn Health programs and care for new and expecting moms.